posting this, and we'll be posting the slide deck and the recording to our website, which I dropped into the chat, in about 7 to 10 days. All participants have been muted upon entry into this call, and that's just because of the high volume of participants we have today and to reduce the background noise. But we do want to hear from you today. So anytime during the presentation, if you have questions for the presenters, please drop them into the chat and we'll get to those at the toward the end. So some best ways to spread what you're going to hear today from this LAN call. We'd like to have you share your approaches and experiences via the chat. We'd like you to identify how information today could be used at your facility and apply at least one idea from today's LAN at your facility, and commit to sharing your learnings and ideas with your colleagues. And we'll take a moment just to make sure everybody's comfortable with the chat, know where you can find it. It is located in the lower right-hand corner of your screen with a bubble. And just want to know if anybody out there has ever applied or used the change package, the transplant change package that is found on the ESRD NCC website, or has maybe your network, your ESRD network shared that with you. So if you could answer that, and it's okay if you haven't. But there's the QR code also to find out where our change packages are located. I see a lot of people think you answered, and that's okay if you didn't. Hopefully maybe this will give you an opportunity to go look at it after this call. Great. Okay. Well, everybody seems to find out where the chat was, so we're getting a lot of responses. So that's really good. So we'll go ahead and get into our presentation today. We do have two presenters, which I'll go ahead and introduce. Our first speaker is Yadira Montoya. She is a program director for the National Alliance for Caregiving. In this role, she oversees key organizational initiatives that focus on the health and well-being of family caregivers living in the U.S. In 2019, she was recognized as a Culture of Health leader by the Robert Wood Johnson Foundation for her leadership in community efforts that improve the health and well-being of Latinx living with dementia and their family caregivers. We also have Melina Pineyro. She is a senior manager of health programs at the National Alliance for Caregiving, where she helps drive systemic change to improve the health and well-being of caregivers. With expertise in program development, community engagement, and strategic partnerships, Melina has led impactful community initiatives in healthcare, academia, and nonprofits. We're happy to have both these ladies here today. I'm very excited about this presentation, and I hope everybody enjoys it. I'm just going to go ahead and who's kicking us off today? Melina?
I am. Thank you. And thank you, Stephanie, for the introduction. Good afternoon, everyone. We're honored to be here today to talk about an issue that's often overlooked, which is the role of family caregivers in the transplant journey. Before we dive into the presentation, for those who may not be familiar with the National Alliance for Caregiving, or NAC for short, NAC is a national nonprofit dedicated to catalyzing change and transforming how the United States recognizes, supports, and values the 53 million family caregivers providing complex care. Through our nationally recognized caregiving research and advocacy, we drive policy, system, and culture change to elevate family caregivers as a national priority. And we do this by fostering partnerships across an array of sectors, including aging, disability, healthcare, philanthropy, and the private sector, with the goal of making family caregiving more sustainable, equitable, and dignified. And one of our key initiatives is focusing on transplant caregiving, which brings us to today's conversation. Next slide, please. Family caregivers play a vital role in the transplant care system, yet they're often overlooked to navigate the system without information, resources, and support that they need. And our goal today is to make sure that we can showcase what these gaps and opportunities are and how we can work together to better support caregivers. So we'll describe the experiences and challenge of family caregivers throughout the transplant journey. Yadira is going to highlight the key findings of our NAC 2024 report, and she's also going to discuss recommendations to improve these caregiver support services. Next slide, please. Before diving into the research, I want to take a time to ground us a little bit. As kidney experts, where do you fit into the larger transplant continuum? As you can see in this image, it does a great job of showing how the road of transplant has many pit stops, and it highlights the key stages of kidney transplant process. So you start from chronic kidney disease and end-stage renal disease, to transplant education, screening, referral, evaluation, and ultimately, hopefully, the wait list and then transplant itself. And at every stage, you as providers play a critical role in determining whether a patient moves forward in this process. And there might be areas where the caregiver and patient struggle with gaps in education, lack of coordination, and systemic barriers that prevent smooth transition between dialysis and transplant. Next slide, please. As I mentioned earlier, one of NAC's initiatives is transplant caregiving, and we have the Transplant Caregiving Collaborative that focuses on enhancing the recognition, inclusion, and support of family caregivers in the transplant system. And we do this by driving practice change within the transplant centers and advocating for federal reform to enhance caregiver support. And this slide, it shows like our milestones for different launches that we had throughout the years. So we launched in 2022, and then from there, we've taken multiple steps. So in November 2023, we released our first major report, which was Transplant Caregiving in the US, a call for systems change, which was a comprehensive report that explored the landscape of transplant caregiving and identified key challenges and needs that many caregivers face in the transplant process. This was done through literature review, focus groups, and subject matter experts. And it laid the foundation for our 2024 report that we're going to discuss a little later in this call. This year, we'll be developing an expert curated resource hub. We'll be releasing additional reports to examine further caregiver support services. We'll be hosting webinars and forums, and we will also be collecting caregiver stories to amplify their voices and inform our efforts better. Next slide, please. Regarding the caregiver stories, something that I love about NAC is that we know that data is important, but we're also aware that stories and lived experience are what move people to action. And storytelling allows us to expose the real world impact of caregiving challenges. It allows us to highlight where the system is failing caregivers. And it also provides us an opportunity to advocate for solution that centers the needs of families. So I want to take some time to share my personal experience as a caregiver of someone with end-stage renal disease. Although each caregiving case is different and comes with its own set of obstacles and barriers, I hope my story helps you reflect on the broader challenges that many caregivers face. So in this image is my mother-in-law, and it's special to me because she was unable to walk in 2023. And from her being unable to walk to today, to being able to stand on the beach is something really important. And it was thanks to the efforts of her resilience and also my husband and I being caregivers. So at the end of 2023, she got extremely sick and she called us confused and scared. And soon after, she was taken to the ER in Puerto Rico. Eventually, she was diagnosed with acute kidney disease caused by rhabdomyolysis from COVID. A few days after that, she was admitted to the hospital, and my husband and I flew to Puerto Rico. And when we arrived, she was weak and disoriented. And we had no idea who her doctor was, what tests had been done, how serious her condition was, what came next. Since I had been a caregiver before, I knew if we didn't come prepared with questions, doctors would rush in and out, and we would continue with no clear picture of what was happening. So I made a long list of questions to document everything I could that happened before we arrived. And I continued documenting after as well, because I had feared that we weren't going to get her medical records for whenever we would come back to the United States. One of the biggest challenges we faced was that every doctor seemed to have a different opinion. We would receive conflicting information about her condition, her progress, and what treatment might look like in the long term. And it felt like we were in this constant limbo, not just emotionally, but physically as well, because we were in another country, unsure when she would be stable enough to go back to the US, which is what we call home. Eventually, the doctors decided that they were going to start her on some medications, hoping that her kidney function would improve. But after a few days, we heard dialysis might need to be an option. Again, we're uncertain. We had no idea what that meant for the future. Would the dialysis be temporary? Could her kidneys recover? We were just told, wait and see. So a central venous line was placed and she started dialysis in Puerto Rico. The medical team hoped that after a few sessions, her kidneys would just restart and improve. But after a month, it didn't. The team decided she needed longer-term dialysis to see if there was a chance for her recovery, but no one explained to us what that meant. We had so many questions we were grappling with as a family. How long is longer term? What does dialysis mean? What does it do to the body? How do we prepare for what's ahead? And like millions of other family caregivers, we found ourselves navigating the healthcare system, and it's really exhausting. This included navigating different doctors and different opinions of the doctors, health insurances, medications, and even small things like finding parking, which for us in Puerto Rico cost over $500 for 2 months. And our journey had this added layer that we're in another country, that although we had no familiar roots, we did have familiar roots. It wasn't our country and we weren't familiar with it. We were fortunate that we had an apartment to stay in, so lodging was free, but we still had to rent a car and eat out frequently because caregiving demands, force us to do that. Many caregivers sometimes have to leave areas that they're familiar with in order to better care or get better care for their loved ones. Ultimately, my mother-in-law stayed hospitalized in Puerto Rico for 2 months. I stayed with her for the first 2 weeks, helping my husband understand the medical system as much as possible. And then he stayed the remainder of the time navigating a fragmented healthcare system in Spanish, which is not his first language. And I went back to the United States, where from a distance, I was still deeply involved. And I was documenting everything, coaching him, making sure he was asking the right questions, and taking sporadic phone calls throughout the day. Eventually, the contingency for her release from the hospital in Puerto Rico was that we had to have a hepatologist in place and a dialysis center. So I started calling multiple centers trying to secure a spot close to home. And I found a dialysis center, luckily, less than 5 miles from us. And they assured us that they had everything ready for her transfer. But something in me told me to call the day before. And I called the day before a flight, and they told me that they didn't have everything that they needed to accept her. So I had to make a lot of frantic phone calls to get everything submitted. We were lucky that I had called the day before and was able to fix everything, but luck should never be a factor in accessing necessary medical treatment. When we arrived to the dialysis center for her first outpatient session, we checked her in, and that was it. We were told, come back in 4 hours. Nova gave us a plan for how to support her at home. No one told us what symptoms to watch out for. No one explained what we should expect. Up to this point, she had only received inpatient dialysis at the hospital in Puerto Rico. So we had no idea what to look out for now that she was outpatient. Looking back, I realized that maybe the information was on a piece of paper, but between the hospital discharge and adjusting to essentially a new life, it didn't reach us, her caregivers who were coordinating every part of her care. And after reflecting, it did make me wonder, how can dialysis centers ensure that caregivers receive this information in a timely manner? A few days after she came back from Puerto Rico, she was hospitalized again due to some concerning lab results. And after several days in the hospital, a doctor mentioned transplant might have to be a possibility. And this was the first time anyone said if her kidney function does not improve, she may need a transplant. And we handed her a pamphlet, and that was it. No conversation, no explanation of the process. From experience, because I've been a transplant caregiver as well, I know that there's more consideration in that conversation. As our dialysis continued, we kept running into gaps in guidance. For example, she had that central venous line in place, and 4 months in, it was still there. And the only instruction we had received was don't get it wet. No one explained how to clean it, what signs of infection to look out for. We ended up researching it ourselves and found a patch to put on her before while she bathed, so it wouldn't get wet. But those were all things we had to look for ourselves. Additionally, We were not provided with any dietary education, so the dietitian saw her maybe once or twice, handed her a sheet of paper with a list of foods to avoid, and no one explained why she shouldn't have potassium. No one told us what she should eat instead. No one provided us as her caregivers guidance. Thankfully, we have a background in nutrition. My husband has a background in nutrition and food, and then I was managing a medically tailored meals program at the time for renal patients. So we were able to prepare foods that were kidney friendly for her. But those were 3 meals a day that took anywhere from 30 minutes to 2 hours, and snacks as well. But what happens to families who don't have that background? Later through my work, I found out that dialysis centers have those resources on the website, but no one told us. And again, this made me wonder, how can that be offered more proactively? Additionally, my mother-in-law met with a social worker who checked on her, made sure she was okay, really kind, she told me. But we weren't considered in the conversation. We weren't checked on to make sure that we had the proper tools to make sure that we were caring for her correctly. So there was no questions about our transportation, our finances, or even how we were doing emotionally. And as many of you know, with dialysis, there's a constant commute. So this is 3 times a week for us, and it was frequent ER visits in hospitals due to the dialysis because she wasn't tolerating it well at some points. And each trip meant gas, tolls, lost work hours, shuffling schedules to make sure someone could take her. And on several occasions, we were moved to different dialysis centers that were 15 to 20 minutes away from the original center. And each time she switched centers, that meant that it was new nurses, new dietitians, new staff, and no continuity in her care. It made me wonder, how does switching dialysis centers impact caregivers? And then this added layer, because she had the rhabdomyolysis, was that she lost significant muscle strength. And as I mentioned in the beginning of the call, she was unable to walk. So this started in Puerto Rico. And so for over a month, my husband had to do everything for her, from assisting with daily tasks to mobility. And eventually he helped her to start walking. But then here in the United States, she needed to be transported with a wheelchair, and she started undergoing physical therapy, thankfully, at home. But all the exercises and the homework that she was assigned, we were the ones in charge of making sure she was doing it, and these appointments were during the day. So we were, shuffling our schedule around, making sure that we were available so we can see what was happening. Eventually, throughout this process, my husband's family medical leave was exhausted, and he had to make a tough decision and leave his job. We were lucky we could manage, but I always think, what happens to families who can't? What about caregivers who don't have the finances or the flexible jobs or can't afford the constant travel? These are all hidden burdens that no one was asking us about, but it impacted every decision we were making. Now, 2 years into the journey, we're wiser, but I think about caregivers who don't have the same resources or background. This experience showed me how much dialysis patients and their caregivers have to figure out on their own. And when I read the NAC report when I first started, I couldn't help but think about how different our experience could have been if we even had a fraction of the caregiver support it recommends. It made me realize that dialysis caregivers are often in need of the same education and resources as transplant caregivers. And many of these gaps were the same ones I had experienced as a transplant caregiver in 2021 for my mom. From unclear communication about transplant options to lack of caregiver education and financial strain, the system often leaves families struggling to figure things out on their own. And that is why NAC is bringing these issues to light. And I'm excited to pass it over to Yadira, who will walk us through the NAC 2024 report. And this report highlights key findings on the systemic barriers caregivers face and lays out actionable steps to better support family caregivers. Thank you.
Thank you so much, Melina. Your story is quite powerful in illustrating the immense challenges that caregivers face when they're caring for a member with a serious illness, all while navigating, as you mentioned, our fragmented healthcare system. And you highlighted several of the themes that I'm going to talk about: critical issues and information gap, communication, miscommunication, as well as the profound lack of caregiver support. So healthcare providers, health systems asking caregivers, What do you need to provide care for the person, for your family member? And what do you need to maintain your health and well-being? So thank you for that. Just want to reiterate that, at NAC, our mission is to elevate the stories and experiences of transplant caregivers. And this commitment is at the very heart of our work in transplant care. We also believe that we need a couple of these powerful stories with data. And so for the next for my part of the presentation, I'm going to be focusing on sharing some data from our report, a report that we released last fall called Gaps and Opportunities, Family Caregiver Programs in the U.S. Transplant System. Next slide, please. The report focuses on the results of research that we conducted in the spring of 2024 to gain a better understanding of the current landscape of family caregiving support within transplant systems across the country. We conducted an online survey that had 32 questions that assessed 3 key areas: caregiver assessment, support and service delivery for caregivers, and education and training. Some of the sample questions that we asked respondents was, to the best of your knowledge, which types of support programs does your transplant center currently offer to caregivers of transplant recipients? And which caregiver-specific education and training programs are available at your transplant center, whether those were provided on site or whether they were referred to a third party? Next slide. As I mentioned, the survey was administered in the spring of 2024 by a health marketing research firm that we commissioned, the Coles Group. And we screened potential respondents to ensure that they qualify to answer the survey regarding the availability of their caregiver support programs in their transplant center. So we are specifically looking for transplant center directors and or support staff. Here in the slide, you'll see that we surveyed a total of 143 individuals representing 114 sites, and that those 103 respondents included both, again, transplant center directors as well as their support staff. Next slide. In terms of the transplant centers, the sample included both solid organ transplant programs. Here you see a breakdown of kidney, which we included kidney, heart, liver, pancreas, lung, and intestine. And we also had a small fraction of bone marrow and stem cell transplant programs reflected or included in the sample. Again, the table shows the distribution of the different transplant programs as well as transplant center types. And then you can see that most of the transplant centers reported that they have kidney transplant programs. So when Stephanie extended the invitation to speak to you all, we were really happy because of this big representation of kidney transplant programs. The other important takeaway that I want to mention from our sample is that we work to include transplant centers across all the OPTN regions, centers with adult and pediatric transplant programs, as well as institutions serving diverse patients and caregivers, that diversity in socioeconomic background, race, income level, as well as geographical area. And while I'm not going to be presenting on that data, I encourage you to read the full report and learn a little bit more about that specific section of the report. Next slide, please. So the good news, most transplant centers reported that they offered a caregiver support program, and in fact that they offered between 2 to 4 programs. Here you can see the types of programs that are offered at each site. And it is important to mention that we define caregiver support program as a structured, planned, coordinated activities and procedures aimed specifically at supporting caregivers of transplant recipients that are part of routine care at the transplant center. So it was This definition we borrowed from an earlier survey that was also looking at caregiver support across cancer centers in the US. And we wanted to make sure to provide a definition which keyed into this routine care part, but that it wasn't a program that was part of let's say a research study that may have been temporary or any other situation like that. However, onto the not so great news. That means that 30% of the transplant centers reported that they had no caregiver support program. And there was also very little consistency in the types of support that was provided. Meaning that there was no standardized program delivery. In terms of how the programs were delivered, it was a combination of on-site system referral or referral to a third-party provider, with in-system referral being the most common. Some of the services that were commonly referred to external third parties included training related to communicating with the transplant team, training related to self-care and wellness, physical and mental health, and then education on necessary medical procedures, tests, and treatments required in transplantation. Next slide, please. So we also asked about what are the barriers to providing comprehensive caregiver support? And respondents, we were really surprised with these findings actually, where the number one barrier listed was awareness of caregiver needs. So this was transplant centers or respondents telling us we don't know that this is a need. That was at 48%, followed by financial constraints, 43%, and limitations of current staff by 42%. Next slide. This graph shows the transplant center staff available to provide caregivers, and over 2/3 of the survey respondents said that they had a designated staff member responsible to provide this type of support. However, when we asked about who the different roles of these, the staff, it varied significantly, and it was usually an administrator, nurse practitioner, physician assistant, social worker, behavioral health counselor. Something that I found quite interesting is that you'll see in the graph, someone from HR is also very helpful. The way that we thought about it was perhaps, someone with like financial assistance or kind of in that realm, but found that the wide range of staff supporting caregivers reported was quite interesting. Next slide, please. As many of you may already know, social support, which usually means the availability of a caregiver, is commonly used as a determinant to determine transplant eligibility for both solid and non-solid organ transplant. Yet there's no caregiver identification. There's no standard in caregiver identification or whether there's an evaluation on that caregiver about assessing their preparedness as well as their needs to serve in this role. We asked the respondents if their transplant center, about the transplant center's practices around assessing a patient's availability of support, and indicated that they had a written process, indicated that they had a process. 27% said they had no written process, and 17% said they were unsure. And so again, we're keen on those respondents who mentioned that there was no written process, as well as those who were unsure. Next slide. The survey also asked respondents about practices assessing caregiver needs, and when of those who reported that they're assessing the needs of caregivers, and at what point during the transplant journey are they completing those. So I won't read you the slide, but want to point out the fact that only 3% of the respondents said that their transplant center was assessing caregiver needs routinely. So I want to repeat that again, only 3% throughout the process. Next slide. So moving on to education and training, close to 60% of the transplant centers reported providing different caregiver-specific education and training at various intervals during the transplant continuum. Again, the offerings were inconsistent and varied. Next slide. So keying into what is being offered, here you see the list of the most common types of education and training, or the categories, which included medical aspects of the transplant process, followed by communication, coordination, and planning. However, education and training or information about social determinants of health needs or caregiver health and wellness were the least common categories that were being offered. Next slide. The survey, next slide, please. The survey also included questions about the awareness of Medicare's billing codes for caregiver training services. And so you may know that the Medicare physician fee schedule is essentially a list of payment amounts that Medicare uses to reimburse physicians and other healthcare providers for the services they provide to Medicare beneficiaries. In 2024, it was the first time ever that the physician fee schedule included billing codes for providing caregiver training services. And so what these codes did was allow eligible providers to bill Medicare for offering individual and group caregiver training services for patients with a mental or physical health diagnosis who needed help with their daily activities. At NAC, we believe that these codes are a significant step in recognizing the essential role that caregivers play within the healthcare system and helping maintain the health of millions of individuals with a serious illness or a disability. And, you know, if I can take you back to Melina's story of the numerous of medical and nursing tasks that her and her husband were tasked with throughout the providing care for her mother-in-law as one of those examples. So what we learned was that despite high awareness of these codes existing at 80%, only 7% of the centers were actively using them. When we dug a little bit deeper, we learned that there was a big discrepancy between the types of transplant centers using these codes, with large medical centers leading in the adoption and utilization of these billing codes, which was at 10% compared to other types of transplant centers that was at a low 0 to 2%. Next slide. So I encourage you to answer this question in the chat about what parts of the report's findings you believe hold the greatest potential for advancing caregiver support in dialysis care. As Melina mentioned at the top of the presentation, this report and our work focuses on the caregiver experience of someone in kind of waiting for a transplant, en route of the waiting list, but just really curious about how this resonates with the audience that is listening in today that is further kind of downstream in that process.
Great, so go ahead. Yeah, there's a few things coming in. Feel free to drop your thoughts and response to that question into the chat.
Yes.
Melissa, yeah.
Thank you.
Got some responses already coming in. Melissa says assessing caregiver support throughout the transplant process, evaluating caregivers at the time of admission of the patient. I think Michael had already earlier, before you posed the question,
Okay.
it needed more funding for, you know, to help toward caregivers.
Yes, all of these.
Yeah.
Thank you for these, that providing like I see them now, providing the care information, building stronger partnerships, I think speak to, are an excellent segue to our recommendations. And so when we get to the Q&A, I'll circle back to these. Thank you for doing that. Next slide, please. So to address the unique challenges of transplant caregivers, we've outlined 6 key recommendations in our report. I'm going to talk about 4 today in the interest of time. Next slide. Implementing a standardized screening process during the transplant waiting list or referral period that evaluates, that identifies and evaluates caregivers is critical, and would establish uniform criteria. It would create a consistent standards for caregiver qualifications across transplant centers and make sure that they're clear and transparent. It would also promote equity, ensuring that all patients, regardless of race, ethnicity, socioeconomic status, have equal access to the transplant list in the case of solid organ. Improve caregiver readiness, proactively assessing caregivers' availability and willingness to provide necessary care would reduce the risk of unpreparedness, and just caregivers know what they are signing up for. We spend a lot of time in the first report that Melina mentioned, providing qualitative data on what the experience is like signing up to be someone's caregiver during transplant, and then realizing that caregivers reporting, realizing that they didn't know the magnitude of the role emotionally, physically, financially. So I encourage you to check out our first report and have some QR codes that we can share with you. And then also, this would also facilitate a comprehensive assessment. So key factors that should and could be evaluated include caregiver experience and comfort, physical and mental health of the caregiver, social determinants of health needs and available resources needed, as well as cultural factors that may impact the home-based care throughout the transplantation process. Next slide. The absence of a uniform approach to gathering and recording caregiver information across health systems creates significant problems. This fragmentation forces transplant caregivers to navigate really disconnected systems, leading to a lack of or insufficient caregiver supports. Again, increasing inequalities and just a lack of comprehensive data on caregiver needs. And so we believe that establishing a care coordinator could serve as a point, would be a really important step. That coordinator could serve as a point person for communicating with caregivers throughout the process, ensuring or supporting the caregiver's health and well-being. With that designated coordinator in place, the caregiver would have someone to ask questions, share concerns, or share requests for additional support. Something that I want to point out in our report, we also included quotes from different caregivers. And one of the things that's important to mention here is one of the quotes from a caregiver shared, like, at the beginning, I had health insurance, I had a stable job, but throughout somewhere in the middle of the process, I did not. And so I really needed someone. I would have really benefited from the transplant center team asking me what was my status at that moment, not just when I signed up or just at the beginning of care. And so specifically that continuous assessment, as well as that assessment and or support in post-transplant, is really important to mention here. Next slide. We can significantly improve caregiver support and transplant care by consistently, again, assessing their needs. This means looking just beyond the transplant recipient's medical needs and understanding the full range of the caregiver, again, who is supporting their care and also has needs of their own. In this survey, we were really intentional about asking about all kinds of support, psychosocial support, basic needs, social determinant of health needs. What does it look like for centers, whether centers are providing those supports in terms of like transportation, housing, mental health services, and again, how they can be adapted to the caregiver and the care recipients, like changing situations throughout the transplant continuum. So implementing routine screenings and not only implementing the screenings, but having those coupled with delivery of supports would be really critical to address this issue and provide caregivers with the necessary knowledge, support, and resources that they need, again, throughout the process. Next slide. Great. So our last recommendation, or the last recommendation that I'll talking about today, focuses on the changes to the Medicare physician fee schedule, which I talked about a few slides back. As I mentioned, there is a high awareness of the caregiver training services codes in transplant centers, but very low utilization. And so this disparity in utilization suggests a missed opportunity for financial support of caregiver training programs and highlights the need for improved implementation strategies across transplant center types. NAC took action to support expanding the caregiver training in the introduction and then the expansion of the caregiver training services billing codes, and specifically in this year to cover training for hands-on medical care. We know that family caregivers are doing a lot of medical and nursing tasks with inconsistent training, and so felt that there was a really important need that we have data behind. These include like infection control, patient monitoring, things that we know caregivers already do. And then as well as caregiver behavioral management support, again, helping the providing support so that the caregiver is able to maintain their health and well-being. And so we also urge CMS to take a multifaceted approach to improving the utilization of these CTS codes, caregiver training services codes, across different healthcare systems, including transplant centers. Next slide. So family caregivers are the unsung heroes of transplant care. They're often left without the support that they need. Our survey revealed major gaps in how we support family caregivers and how these gaps lead to different inequalities across racial, ethnic, and socioeconomic lines. Again, encourage you to look at the report. And our report is a step or effort to talk about it, to fix it. We found that without standardized support and coordinated support, caregivers really struggle, and that really impacts patient outcomes. Our recommendations are to create a more inclusive system that truly recognizes and supports caregivers. And to do that, we need to make it happen. We need everyone working together. So policymakers, healthcare providers, researchers, and advocates. And most importantly, we need to listen to the voices of family caregivers themselves. So by implementing these strategies, we believe that we can reduce caregiver burden and improve the lives of both the transplant patients and their caregivers. So got a little bit ahead in my slide here, but I just would love to hear how these recommendations resonate with you, and how can they be adapted to better support caregivers in the dialysis care. Caregivers who are supporting someone receiving dialysis. So would love to kind of end it here and jump into the Q&A with this question.
There's a lot of chatter going on. I don't know if it directly is answering that question, but
yeah,
a lot of interest and a lot of comments. It's been very active over here, this chat. So you have certainly touched on a very, I think, good point here. And I had to screenshot a couple because they were kind of coming in quick. So
yeah, I'm really curious about this theme of caregiver. It sounds like some of the audience members have offered caregiver supports, but without any uptake. And as a caregiving organization that talks, breathes, thinks all about caregiving, and the fact that data from this research is saying we don't know that those exist. We don't know that caregiver needs exist. I'm just really processing and thinking through that discrepancy of what's coming through the chat. one of the things that it makes me think about in particular is the inconsistency in caregiver support programs that we found in the transplant center, where there was no standardization. And to me, it raised questions of that might be good, maybe, if programs are tailored to communities. But if, as someone who has done direct service, I think that's the key of making sure that there's a standard, but that it responds to, that those support programs respond to community needs and patient needs. And I think that's kind of like the perfect, I think when programs are successful.
Yeah, there was a comment, I don't know if it was really a question, was a comment that I found interesting and I pulled off and I wanted to put it out to the both of you to see what your thoughts are. And I think it was early on talking about caregivers and they, what the requirements were. But they also said it can become a barrier, but some people can also put together a team, but if they don't have one person, what are your thoughts about that? I mean,
oh, this was in terms of staff to provide caregiver support. Yes, I think that a team would be ideal. For our recommendation, we said there's already in transplant centers a transplant team. And if one of those individuals in that transplant team can be dedicated to the caregiver needs, to caregivers, and assess their needs and provide support and connection, then that to us that would be a huge monumental step. But I also want to give Melina a chance to chime in, especially as we were talking about the participation and uptake of caregiver programs available and just how much caregivers have on their plates already. And so I'm just curious if you had any reactions or anything to add to my response earlier.
Yeah, I see in the comments that a lot of people are saying that people don't attend the support groups, which just makes me think the times that I've been a caregiver, you feel so overwhelmed. And most of the time, the support groups that were available to me were in person, but and I was too busy taking care of my person. So it makes me wonder if virtual should be an option. I know that some hospitals provide virtual opportunities, but I wonder if that should be like a standard. So maybe different hours as well, because if you're offering these sessions either too late or too early, then you might not be able to attend because you're at work or you're doing your caregiver duties. So it goes back to your original comment, Yadira, that sometimes you have to create systems that are for the community. Each community is different and there has to be like variations in order to accommodate. I know it's hard for an array of caregivers, but something a bit standardized to help.
And I see maybe part of what you were alluding to, Stephanie. Chat is coming in very, very
so
quick.
fast.
Coming in hot and fast.
I think that I'm keen into a question from Brianna about multiple caregivers. And that is something that we didn't assess in this particular survey. But what we have learned is that there's no standardization on whether transplant centers are requiring one caregiver or like a team of caregivers, or whether it's a paid caregiver, or a family caregiver. And that's what we mean in our first recommendation, that having a standard and understanding and having that be uniform would be so helpful for caregivers, because right now it is kind of all over it varies very widely. And so, and that information is not easily accessible where I can type a Google search and say, like, tell me what is eligible. And so it requires a lot of legwork of the caregiver to email, call, investigate. And I'm going to turn it over to Melina, because she has, or you have direct experience in figuring out the caregiver requirement. So I would love to hear.
Definitely, I agree that researching, it's not a simple Google search, because a lot of the transplant centers require you to call and speak to someone in order to get more information. And then when I was on the transplant journey with my mom, her center required 2 transplant caregivers. And then there's another center that we were looking at, and they only required 1. So I agree, there's a big variation between how many caregivers a person needs.
Yeah. I also just gonna admit that it's been sporadic. What I'm picking from the chat is just kind of what I see. But that's something I want to echo what Nita mentioned in terms of post-transplant. That's also, and encourage you all to look at our first report where we talk about when we present the findings from focus groups with transplant caregivers and subject matter experts in transplant care. And that finding was loud and clear that when you look at the transplant continuum, most of the support and resources center at the beginning of the journey versus post-transplant. And caregivers saying, I needed a lot of help. I wanted a lot of help and support plus post-transplant. The surgery was great, but I also had to learn how to change my life in terms of my care recipients, like new reality, whether that was a different diet, whether it was like different mobility issues, whether it was, figuring out back to work situations. And so the first report really goes into that. Into that topic. So encourage you to do that.
Yeah, I think that discussion that is going on in there in the chat about, what the appropriate number is for a caregiver, and I don't know that anybody knows that, but I think that might be, interesting to talk more about it and look into it more, and maybe that's why some caregivers back out, because they feel like they have to do it by themselves, and maybe that would be more beneficial if they knew they could have. And Melina, you probably know better than anybody what the burden and the burnout is of being a caregiver. So having someone to give you a break, that might be actually a good thing, and families may be a little more willing to step up and take on that caregiver role, knowing that.
No, I agree. I know when I worked with the renal patients in my food as medicine program, it was a lot of caregivers who were alone in the journey, and they were working long hours, and then they also had to make sure that their person was okay. So I was fortunate that I had, my husband who was helping out. Because when you're by yourself, it feels impossible to be a caregiver. And that burnout I saw someone mention is extremely real, no matter how many people are helping.
I know we're getting close to the top of the hour, but anything did you see in the chat you want to specifically address, or?
Yeah. I see a comment from Maya about additional tools to give to caregivers. We have been, as part of our work, Melina mentioned creating a curated resource hub. And so while that is not public facing yet, if possible, would love to share some of those with you, Stephanie. There are a couple of transplant caregiving toolkits that might be helpful for the audience. And I want to thank you for pulling this up. These are the QR codes for 2 reports. The first one on the left is the results is for the research that I talked about today. But then our first report, A Call for Systems Change, talks about that qualitative data and digs a little bit deeper into the caregiver's experiences pre and post transplant.
Right.
Next slide. I think I have something else. Yeah, and if you would like to connect with us and continue talking about all of these good topics, please do so. As Melina mentioned, we are launching a caregiver or a peer learning community where we're going to be meeting and having webinars. We also are going to be collecting caregiver stories that we're going to put in our website to really elevate and uplift the different transplant caregiver experiences. As well as different policy and advocacy opportunities that we didn't get to discuss today. So please reach out. We're excited to connect with you all.
Thank you. Well, thank you both. A lot of kudos coming into the chat right now. A lot of good dialogue and a great presentation. Thank you so much for both of you for being here today for this very important topic. It was very, very, for me, informative. I hope everybody else enjoyed it as much as I did. So just wrapping up here today, we're going to take moving from learning to action. We want you to take some of these ideas, what you've heard today, the best practices from this presentation, share with your colleagues. Again, I'll refer you to the ESRD transplant change packages that we have on our website. So it's another way to help improve outcomes and overall the patient experience related to the transplant. And I just want to let everybody know that when this event concludes at the top of the hour, every participant will be sent an email. It will have a link to a short feedback survey. We want to hear from you. We want to know how this presentation was, what we could do better, what we could change. Take a few minutes. Also included in that email for any professionals that are on the call today are the links to the CEUs. So please make sure you don't, you get that email. If you don't get it, receive it for whatever reason, just email nccinfo@hsag.com and we'll be glad to send that out to you. But that automatically come in to your email box at the close of this. So thank you again, everybody, for taking time out of their day, having a good discussion. Thank you both presenters, these ladies today, for taking time out of their day. We've enjoyed this presentation. We've enjoyed working with everybody. Thank you so much and take care.
Thank you.
Thank you, Stephanie.
Thank you.